Good afternoon, everyone. Maine public, we are less than a minute out. Good afternoon, everyone. I'm Nirav Shah, the director of the Maine CDC. I'm joined this afternoon by Commissioner Jean Lambrou from Maine's Department of Health and Human Services. Commissioner Lambrou and I are pleased to be with everyone this afternoon to talk about where things stand with COVID-19 for the entire state of Maine for today, Wednesday, December 22nd, 2021. We begin today's update on yet another sad note. The Maine CDC is reporting 5 additional COVID-19 associated deaths today. One was a resident of Androscoggin County, another a resident of Aroostook County, a third from Hancock County, a fourth from Kennebec County, and a fifth from Knox County. 3 of these most recent deaths were among women and 2 were men. One individual was in their 60s, 3 were in their 70s, and 1 was in their 80s. These 5 deaths bring the total number of deaths in Maine associated with COVID-19 to now 1,468. We'd like to take a moment to offer our deepest condolences to the friends, family members, and communities of all of those who have passed away with COVID-19 this year. Overall, across the state, there are now 139,421 cases of COVID-19, representing an increase of 1,462 cases since yesterday. Right now in the state, 375 people are in the hospital with COVID-19. 124 of them are in a critical care bed, and 60 of them are on a ventilator. As of this morning, there are 53 critical care beds available in the state, 45 adult and 8 pediatric or neonatal beds. And Maine CDC is aware right now of at least 8 children who are currently hospitalized in Maine with COVID-19. 4 of those 8 are in the ICU right now. It also continues to be the case that approximately 65% of all patients in the hospital across Maine who are there for COVID-19 are not fully vaccinated. It also continues to be the case that as you move up the severity ladder into patients who are in the ICU and patients who are on ventilators, that percentage, the percentage of patients who are not fully vaccinated, grows larger. For example, just to use one hospital system example, at Northern Light Health, as of a few hours ago, 91% of the patients in their ICU beds across their system, 91% were unvaccinated. That's 30 out of their 33 ICU patients with COVID were unvaccinated. And if you look at the patients in their health system who are on ventilators because of COVID-19, 92% are unvaccinated. 12 out of the 13 patients on a ventilator are unvaccinated. This is further evidence of the beneficial impact of vaccines, especially now, and as we talk about the Omicron variant in a moment. Before we do, let me turn to vaccines and vaccinations for a moment. Right now in Maine, we are administering approximately 9,130 doses of COVID-19 vaccine every single day over the past 7 days across the state. 74% of all the shots that are going into arms right now in Maine are booster doses. And as of this morning, 75.3%, that's 3 out of every 4 people in Maine, are now fully vaccinated. And among those fully vaccinated folks, 40% have gotten a booster shot of some sort. That's strong work by Maine people, but we've also got more work to do on the booster front. One quick update or set of updates on where we stand with the Omicron variant. As folks probably saw this past Friday, we detected the first 5 cases of the Omicron variant in Maine. There will certainly be more. Though it is not the dominant variant in Maine right now, it may very well become the dominant variant of over the next few weeks. Now, the bottom line with Omicron is that right now, based on what we know, it's concerning. Its greater contagiousness means that it is a new variant that we have to reckon with. Recent data suggests that it will cause a spike in cases, as it has done in other countries around the globe. And that spike may increase the strain on hospitals, which, as I'll mention in a moment, are already under great stress. So what can you do? The first thing, the most important thing, is to be smart about Omicron. Take it seriously. Now, there is some chatter out there that Omicron might be mild. The bottom line is we don't know. Mild compared to what? Mild for whom? There are still a lot of scientific questions out there that need to be answered before we can make any definitive statements about its severity. That's why, in terms of its severity right now, the answer is we don't yet know. But what we do know is that many of the tried and true elements in our response so far are effective against Omicron. For example, vaccines, and in particular, boosters, continue to be among the best defenses against Omicron. The vaccines aren't alone. Other standard mitigation steps that we've all been used to now, like wearing a mask in indoor public settings, protect just as well against Omicron as they have against prior variants. Omicron is something to be taken seriously, and as we learn more about it and as we detect more cases, we'll be here to provide you with the latest. Before I turn things over to our colleagues in the media, I wanted to take a moment to talk a little bit about reasons for grace, graciousness, and gratitude during this holiday season. Now, no matter which of the winter holidays you and your family observes and celebrates, each of them has a common theme around being gracious and offering gratitude to those who have played a big role in our past year. I'd like to take a minute today to talk about a couple of groups who, from a COVID-19 response perspective, have been instrumental in Maine's overall approach over the past year, now almost over the past 2 years. The first group are healthcare workers. Across Maine, healthcare workers this season will continue to go to work, taking care of our parents, our spouses, our siblings, and our friends, regardless of whether they have COVID. And they'll do this in a variety of settings. Healthcare workers at hospitals, nursing homes, EMS stations, home care workers, hospice workers. Every sector of the healthcare system has played a role in our response to COVID-19. The work they do matters, perhaps now more than ever before. And they do it especially over this holiday season because the disease doesn't take a break. These healthcare workers deserve our gratitude this season. And if you know one, and you must, give them a high five and thank them for their efforts throughout the pandemic. The second group that I'd like to shine a spotlight on are public health workers across the state of Maine, including the entire team at the Maine CDC, indeed the entire team at the Maine Department of Health and Human Services and across Maine state government. Those teams this holiday season will be working, analyzing data, running laboratory tests, delivering vaccines to healthcare providers. They too deserve our gratitude for their extraordinary efforts over now almost the past 2 years. And so if you know a public health worker across the state, whether it's at the local, the county, or the state level, or someone who works in public health at a hospital or any other healthcare facility, please take a moment and express your gratitude for them for this season. The third group is a group that I truly believe sets Maine apart from other states. And that is our strong core of volunteers across the state. Hundreds of Maine people who throughout the pandemic have raised their hand and said, I will donate my time and my skills to be part of the response. These are people who will be, for example, working until 7 o'clock tomorrow night at the Augusta Armory to help people get their COVID-19 shots. Many of those same people will be back on Monday morning, back at the Armory, continuing to help people get their shots. It's not just at the Armory, though. Right now, there are volunteers who are helping out in Calais, helping people get tested and vaccinated. In Auburn, at the mall, there too, helping people get their shots in both clinical and non-clinical roles. These are your friends, your neighbors, your family members who have dedicated their own time to help as part of the larger effort. This season, I'd like to offer them our collective thanks and give them our gratitude. If you know one of those volunteers, or if you'd like to become one of those volunteers, it is not too late. The next group is a group that has been with us since the very first days of the pandemic. And these are the men and women of the National Guard here in Maine. They have helped in so many roles throughout the pandemic. And as you've heard Commissioner Lambrou and me talk about, their role is only expanding. National Guard members were active in the early days, helping us get healthcare workers fit tested so they could enjoy the benefits of an N95 mask. They've been instrumental in our logistics framework throughout the state, helping to get vaccine and PPE to places where it was needed and doing so in a hurry. More recently, members of the Guard have been serving as vaccinators at the site in Augusta, as well as at the Auburn Mall. And again, as you've heard Commissioner Lambrou discuss, more recently, we've deployed more and more members of the National Guard to help in a number of non-clinical roles to take some of the pressure off of hospitals so that healthcare workers in those facilities can focus on providing clinical care. The men and women of the National Guard have been with us since day one, and every time we've asked them to serve, the answer has always been an unequivocal yes. If you know someone in the National Guard who's been serving, please offer them your thanks as well as your gratitude this holiday season. And there's a final group that I think needs our grace during this difficult time. And that's the people in your life, your friends, your family, your community, each of whom right now is probably looking at the future of the COVID pandemic in different ways, based on their own risk. You know, these days, it seems like when it comes to COVID, each of us feels like we're on an island. Everyone who's taking COVID more seriously than you is an overreactionary worrywart. And everyone who's taking COVID less seriously than you, it's easy to cast them as someone who doesn't get it, someone who's denying science. Of course, neither of those extremes is true. What is true is that everyone approaches COVID differently through their own lens, a lens that reflects and refracts their own health status, their family's health, whether they've been vaccinated, as well as a host of other factors. No two people right now will think of COVID and their own risk in the same way. And that means that no two people will take the exact same set of steps, especially as we go into the holiday season. Now, this can be bewildering. In some cases, it can be downright infuriating. But it's important to note that when you're encountering those folks who are taking COVID more seriously, as well as folks who are taking it less seriously than you, that we all bear in mind that they're all looking at COVID through their own personal lens. Rather than being frustrated, rather than being bewildered, my ask is that you approach those folks in your life, not with frustration, but with grace. Recognize that they're coming at this world, a messy, bewildering world, with a different set of thoughts and values than you may be. It can be frustrating, but it's also a time where grace will get us much further than will irritation. With that, I'd like to turn things over to our colleagues in the media for any questions they may have. And the first question today goes to Patty White.
Thanks, Dr. Shaw. There are a lot of things happening to support hospitals right now. Some are already in place and other actions are pending, but what's your understanding of how the health system is doing? Has any pressure been alleviated at this point, or has it just been stabilized? Northern Light painted a pretty sobering picture today about how fragile the system is.
Yeah, Commissioner Lambrew and I have had the opportunity just recently, as we always do, to check in with hospitals and get the latest ground truth. Commissioner, may I turn that over to you?
Sure. So as we've been doing throughout the pandemic, we regularly talk with our hospital leadership to assess what's going on the ground. We do know that there has been some slight alleviation. I don't know if this is a trend, but a slight alleviation in some of the pressure. But part of that is because we have been making these changes to try to appropriately care for patients in the right setting. So through all the actions we've announced to date, from the federal resources coming to the deployment of the Maine National Guard, to our use of the volunteers, our different types of assets, as well as some waiver programs, we've been able to free up, we think, an estimated 150 beds in nursing facilities, in hospitals, in some of our psychiatric hospitals, in order to try to decompress those hospitals that are most strained by COVID-19. There's more work to be done. We are closely monitoring the situation. We still look forward to additional resources coming our way. We did welcome President Biden's announcement yesterday of additional options for the state of Maine. We are exploring those options, going to take advantage of them when they make sense for the state of Maine, but we will keep our hard work going during this holiday season as we try to maintain our hospital capacity for all Maine residents, including those with COVID-19.
Okay, thanks. And can you talk a little bit about, I guess, what are we potentially facing, even though, there are all these different supports happening, when Omicron becomes the dominant strain, assuming it does, and there's, potentially exponential growth. I mean, what are we facing? I guess just Mainers and hospitals. Like, what could that potentially look like?
I'll begin by talking about hospitals and then turn it over to Director Shaw to talk about Omicron. We do anticipate that the current high levels of hospitalization will persist. It could get worse. We continue to cycle through all of our options. For example, we're working with our nursing facilities here in the state of Maine to see how better we can support them to be able to open up some beds to have those patients in hospitals that can be discharged, get those beds, get there safely, and really recover in a way that makes some sense. We are very excited about the announcement yesterday that the federal government approved of a federal set of ambulance crews that will be arriving in Maine next week. What they will do is help transport non-emergency patients from one bed in a hospital that may be stressed to other beds in hospitals or nursing facilities as a means of decompressing them. And as a note, this is a complement in doing a different type of transport that our own EMS does. We know that this is particularly important as our own first responders are also feeling this crunch of COVID-19. So this will alleviate some of the pressure when the need to transport exceeds our own main capacity. So we're excited about that. This kind of daily triage and movement and identification of placements for our patients in Maine will help, again, make sure that the people who need a specific type of care have access to that care in our hospitals.
Hey, on Omicron generally, we've been keeping very close tabs on data that have been emerging from Denmark, certainly from South Africa, more recently from the UK. And although case numbers have gone up, as you note, exponentially in each of those, the growth charts look like vertical lines in some respects. Hospitalizations have gone up a little bit, but not at the same pace, not with the same slope. That's encouraging, but it's also too early to tell because, as you're aware, Patty, hospitalizations can lag by 10 or 11 days, and then sadly deaths a good number of days after that. So it's still a bit too early to get a clear picture of what Omicron might mean here in the US.
Okay, thank you very much.
Thanks, Patty. Let me go to Chris Costa next.
Hi, Dr. Shaw, Commissioner Lambrew. Kind of piggybacking off of Patty's questions, and I don't know how much more you can really expand based on what you've already done. I know this question has kind of come up in the past. I hate to sound a bit like a broken record, but is there a next step or a contingency plan? I understand that you continue to cycle through all these different options, the transporting, the opening up of beds in other hospitals, et cetera, et cetera. Is there a concern that if the cases and the number of people needing to go to the hospital rises past a point where we can adequately maintain that kind of patient inflow, outflow, what would be the next step?
Yeah, I can, Commissioner, please go ahead.
We assess the situation at hand. We plan for different scenarios. The response to any actual situation would likely be modified depending on that scenario, what's going on at that time, what are the existing capacity. And look, I am excited about the fact that each week we've learned about different opportunities and different ways to expand our capacity. Again, the announcement yesterday from Washington includes Department of Defense medical teams that may be deployed to different states. Federal staff who can help vaccinate and test, which would free up some clinicians here in Maine to go back to hospitals or nursing facilities or other types of healthcare settings. And we also are focused on behavioral health. How do we make sure that we maintain that capacity? So there is no single rigid plan for what we would do at some threshold of a number that would mean we go to that plan. We assess it in real time, looking at scenarios, doing that kind of planning for all different scenarios. But the tools that we have and the opportunities that present themselves have changed over time, and as such, our plans have as well.
Okay, I understand. Dr. Shah, I think this question might be geared a little bit more towards you, but Commissioner Lambert, if you have something to add, please, I would welcome it. This afternoon, we heard that the US FDA approved the Pfizer pill for potentially at-home treatment for mild to moderate COVID-19 symptoms for those 12 and older. I know that it's very early on. It literally just got approved a couple hours ago. Do we have any idea what our supply of that would look like? And do you know who would be kind of prioritized for that kind of care versus something like a monoclonal antibody?
Yep, great question, Chris. So a couple of notes there on the new approval of this Pfizer pill, Paxlovid, as it's been termed. It is encouraging. That's really bottom line up front. This is a welcome addition to the host of tools that clinicians have available to manage and provide care for COVID patients. So it is a welcome addition. But I want to temper that enthusiasm a bit, going to wet blanket mode a little bit. Although the drug works and it appears to be effective against Omicron, which is also good news, the supply of the product at the outset will be quite limited. I'm going to answer your question in a moment. But nationwide, for the month of December and into early January, there will only be 65,000 patient courses nationwide. And then in January, at some point, the federal government is expecting another 200,000 patient courses nationwide. So between now and say February, we're looking at 265,000 or so patients who may benefit from this. It's a great number, but to your question, how many of those will be coming to Maine? We have not been told what our allocation will be yet. We've not been told when we will be informed of that, but I anticipate it being over the next few days. The drug, again, it's beneficial. It appears to work against Omicron. Those are all positive things, but the supplies will initially be limited, and that unfortunately will be a constraint on our ability to use it widely.
My last question, Dr. Shah and Commissioner Lambert, just has to do with testing. Obviously, President Biden's announcement about the deployment of 500 million at-home rapid tests is very encouraging. That accessibility for people to be able to test and get a relatively quick answer. But we do know historically that rapid tests have been perhaps less accurate than a PCR test. And we know that people are urgently trying to test as it comes to traveling, making sure they don't get sick and ending up in a hospital, or seeing family members and exposing them to COVID-19. What else is in place right now as the federal government works to stand up more testing sites? Is there anything that you can shed some light on how that'll look in Maine?
I can start. Chris, first of all, we're still digesting President Biden's plan and understanding what the nuances are and what they will mean for Maine and when they will mean that for Maine, because the need for more testing is here right now. So we're still trying to understand and work with our federal colleagues to really make sure we can maximize what of the president's plan will be able to come here to Maine. But Chris, I want to pick up on an underlying theme or thread in your question, which is how do rapid tests stack up against PCR tests? Because throughout the pandemic, we've said PCR tests are the gold standard, and they still are. However, in this day and age, with especially the Omicron variant, which can spread and multiply so much more quickly than even prior variants, the utility of rapid tests goes up in those settings because you can take the test right before you go to an event or a gathering or a party and have a pretty good sense of whether you're infectious as you're walking in the door before you're hopping in the car. In an era of a virus that replicates more quickly and spreads person to person more quickly, the so-called incubation period being much shorter, rapid tests are a strong tool in our closet.
Thank you both.
Thanks, Chris. Let me go next to Emily Bader from the Sun Journal.
Hi, good afternoon, Dr. Shah. So I wanted to first go back to breakthrough cases and Mainers in the hospital. So I heard from Central Maine Medical Center leadership a couple of weeks ago that they had 29 patients and more than half were fully vaccinated. Now, I don't know what percentage were in the ICU or on ventilators, and I know you can't speak necessarily to that hospital on that date, but that of course is significant. So can you maybe shed further light on what this means? Like, should people, that seems like concerning, but we hear from you and others that it still remains most people who are being hospitalized are not fully vaccinated.
Right, and that is the case, Emily. The key to look at is what is the rate of, what is the likelihood of being hospitalized, being put on a ventilator if you are vaccinated versus unvaccinated. That is really the central question. And the latest data from the CDC make it strikingly clear. Being fully vaccinated reduces your risk of having COVID, being hospitalized for COVID, and dying from COVID by multifold. I think the latest numbers are 8-fold, 14-fold, and I forget what it is for ventilation. That's really the operative number. When you're looking at the percentage at any one time, what you have to adjust for is what's called the base rate. And I won't go into it much here, but the fact that there are so many people in Maine, 3 out of every 4, who are fully vaccinated, means that something that happens at a small likelihood in that population will manifest itself much differently because 3 out of every 4 people to begin with are already fully vaccinated. So this is an example of where there's statistics and then there's statistics. And they can be misinterpreted unless you sort of adjust for that base rate.
Right, okay. Second question, in terms of the ambulances from the federal government, so I understand that they will help transfer patients, non-emergency patients, but is there a possibility, like, hospitals are full and nursing homes are lacking staff? Is there a possibility that these ambulances will arrive and there's nowhere to take patients to? And if that's the case, or if that's not the case, what do we do?
Maybe I'll answer that question, which is we are hard at work on the protocols for the deployment of these federal resources to, first of all, make sure that our own EMS and ambulance services are the first place to go. These are the people who work in our communities. They're our first responders. This is their job. But when there's not an option to appropriately transfer, when there's an agreement from one facility to another for this non-emergency transport and there's no local option, that's when these resources will come in. So it is always a case when there is a facility-to-facility transport happening, that there is an agreement before that patient is moved, that there is appropriate care and a bed in the facility to which that patient's being sent.
Okay, thank you both.
Thanks, Emily. Let me go to Brian Sullivan next.
Thanks, Dr. Shaw. I wonder if the data is available for patients that go on to ventilators and the numbers of people who recover once they're put on a ventilator and the number who sadly do not, and if that has gotten better or worse throughout the pandemic.
Yeah. So Brian, it has gotten better if you go back all the way to March of 2020, and that's just a function of the fact that there are better clinical protocols, a better understanding of the ways in which to optimally care for COVID patients. But to your question, which I think is about the more recent history, say with Delta and then the pre-Delta era, what has changed there? And my understanding of the data is that the rates of survival, which is what we have to call it, of patients who are on ventilators has not changed appreciably, but this is an opportunity for me to ask our medical officers to go back and refresh those data and see what we've got. So I'll ask our team to take another look at those data and we'll be back in touch with you.
Okay. And then are there any plans for a walk-up vaccine clinic in the greater Bangor area at this time?
A walk-up clinic?
No appointment necessary.
Yep. We've been working with Northern Light and EMMC. They've stood up an appointment-based clinic. I'd have to check with them to see if they're looking to convert or open up any slots on a walk-in basis.
Okay. And then lastly, maybe you're going to end with it, but a checklist, or if you will, of before people head out to gather, what you should do or not do before you go have a holiday gathering.
Sure. I wasn't. Yeah, was debating whether to talk about that in the prepared portion or not. But Brian, here's the bottom line. It hasn't changed appreciably since when we talked about it in the run up to Thanksgiving. And that comes down to basically two questions. Is every single person in your gathering fully vaccinated? And by every, once again, I mean every, even the young children. And by fully, we mean fully, 2 weeks after their second dose. And if the answer to that is yes, that's a gathering that can occur with relative safety, not absolute safety. That doesn't exist right now, but relative safety. But I'm assuming that most gatherings are not like that. Most gatherings are hybrid of different sorts, with young kids who can't be vaccinated, or older folks who may be vaccinated but have really significant health conditions, like an organ transplant. In those settings, you've got to take steps to be safe. It's no fun to wear a mask indoors, but that may be what's called for. No fun to crack the windows open when it's cold, but that's a way to improve ventilation. And we know that tests are hard to come by. We acknowledge that, but they are available. Commissioner and I were just chatting early about what we were seeing in our respective neighborhoods, and we've both found them and seen them on the shelves. Maybe short-lived, but if you see them, grab them, because testing before you head out the door, before you hop in the car to go to that party or go to church, that's a way to keep everyone there really safe.
Thank you.
Yep, thanks, Brian. Let me go next over to Crystal.
Thank you, Dr. Shaw. We've seen a very good vaccination rate in Maine, and yet recently, we've been declared a hotspot across the country. Can you give me any details, and is there any correlation between the number of people who've received J&J, Moderna, and Pfizer to date in Maine?
Crystal, the bottom line, based on where we are right now, is that all three vaccines are continuing to provide strong protection. So I don't want to draw strong distinctions between those. However, late last week, the USCDC, after reviewing their advisory committee, which is then sent up to the director for her review, took a holistic look at the data behind the Pfizer and Moderna vaccines relative to the J&J vaccine. And what they found, also taking into account some rare side effects with the J&J, what they found was that on balance, all else equal, the Pfizer and Moderna vaccines are recommended over the J&J vaccine. Now, this doesn't mean that the J&J vaccine is substandard in any way. It means that if you've got a choice, and nowadays most folks do, all else being equal, the best first shot, second shot, or booster is the Pfizer or Moderna product. That doesn't, again, mean that the higher cases of breakthroughs are directly attributable to more or less J&J. It means that in a world with choices, we should try to strive for what we know to be the best available vaccine out there. And right now, those are the mRNA ones.
And I do appreciate that, but what I'm really asking you is how many people in Maine got vaccinated with J&J, how many people with Moderna, and how many with Pfizer today?
Oh, sure. Those numbers are on our website. They're on our
Okay.
vaccine dashboard under the middle tab, and it breaks it down by vaccine.
Okay, thank you.
Yep. Let me go to Mel Meyer next.
Thank you, Dr. Shaw. And I do actually have a follow-up about that. I know that in Maine, there are more than 100,000 people who ended up getting the J&J dose. At least, I don't know how many people ended up getting the booster or a second dose of the J&J, but they at least got one dose of the J&J vaccine. And as you mentioned, some studies are now showing that it may not be as effective. And there's also especially concerns on how it may hold up against Omicron. So I'm wondering, because I have heard from somebody who is very concerned about this, especially because they have already gotten that second dose. What should they do in that case if they can no longer get another dose of an mRNA vaccine?
Yep, it's a great question, Mal. It's certainly come up. You know, that person should feel good that the protection they're getting is still quite strong, particularly against things like hospitalization, severe disease, things of that sort. You're right. Right now, the USCDC's recommendation and the FDA's emergency use authorization mean that that person is now considered both fully vaccinated and boosted. And so there's not really a pathway for other vaccines to be put on board. But again, what we know about the J&J vaccine, even the 2-dose series, first shot and booster, is that it provides strong protection, even against things like hospitalization. The other piece, Mel, that's not often discussed, but is important, is the durability. How long does that protection last for? And there are some early signs that the J&J vaccine may be a little bit less effective, but theoretically or possibly a little bit more durable. We need more data there to really flesh that out.
Then my other question is just about the boosters, because there has been so much focus, especially from you and other healthcare officials, about the need to get boosters with concerns about waning efficacy and just rising case counts and now the new variant. And clearly people have heeded that call here in Maine. According to the state data, more than 433,000 Mainers have received a booster dose. When might you see signs that this approach of getting as many people boosted is working here in Maine?
Well, it's important to think about or talk about what the boosters are intended to do. What the boosters are intended to do is to avert illness. We're taking a group that is already at a low likelihood of illness, hospitalization, and death, and getting them secured for the long haul. That's effectively what a booster does. It tops you off. Indeed, some data even say it gets you back better than you were before, and then sets you up to be protected for the long haul. So unlike early on in January of this year, December of last year, a year ago now, where the focus was on driving case numbers down, the focus for boosters is preventing infection with Omicron, as well as setting people up for the long haul. The reason we think boosters are so critical right now is that based on the data we've seen with Omicron, which has started in Maine but not taken hold in the manner that it has in, say, Denmark or in South Africa, we want to stop that from happening here. That's really what we're looking at to do with boosters. It's about averting new cases rather than trying to tamp down on cases that are here now, although it will do that as well. Let's hope.
Thank you.
Thanks, Mel. Let me go over to Megan from WMTW next.
Thanks for taking my question. Since the administration's request to the federal government for more monoclonal antibodies was approved, I would assume that means that Maine is seeing early or positive results. Can you maybe describe the positive impacts that we are seeing here in Maine? And do you know roughly how many Mainers have received these kinds of therapies and how many stand to receive it?
So Megan, just focusing on monoclonals, correct?
Yes.
Good. So we can get you the roll-up of what hospitals have reported that they've administered based on the doses that we as a state have received. What we've seen with the Delta variant is that monoclonal antibodies, there are 3 of them out there. that in light of the Delta variant, the 3 monoclonal antibodies that are currently available have been quite effective at reducing the degree of illness, have been effective at keeping people out of the hospital. We've seen it both on individual patient level, patients who had a lot of predisposing signs of needing to be hospitalized, who after administration of monoclonals were able to stay safe and isolate at home and avoid what would have otherwise been a very high likelihood of hospitalization. Again, we can get the data that have been reported by hospitals and providers in terms of what they've used. The piece, Megan, that is of note is what do monoclonals mean in the future based on the Omicron concern? And there the data are a little bit less encouraging. Of those 3 monoclonals, right now, only one of them is thought to be effective against the Omicron variant, and that is one that is in short supply. So our team has been working very closely with experts at the federal level to understand how this might change prescribing and use on the ground here in Maine, as well as to help us get projections of what the supply of this one drug will look like.
And when you say short supply, larger supply than the pill that was just approved today, meaning 265,000 people nationwide between now and February. So it's larger than that, right?
Megan, I don't know. I'd have to go back and check what the nationwide supply of this third monoclonal, it's called Satrovamab. I'd have to check and see how many patient courses are available right now. And I don't know the answer to that nationwide.
Okay, thank you.
Thanks, Megan. And by the way, bad news bearers, that won the internet last week. Let me go to Patrick Whittle next.
Thank you very much. A little bit more cold water here. I have sort of a broad question for you. The Director General of the WHO said earlier this week that the drive to boost in the developed world could have sort of a punitive impact on the developing world because of the finite supply of vaccines. And I'm curious what there is to be, how we square that with the advice that folks should be getting boosters. And beyond that, if you have any thoughts about the sort of sometimes conflicting nature of provincial, national, and international advice about these kind of recommendations, I think that would be good to hear about.
Yeah, I can start, Patrick, but I want to say right at the outset, I'm aware of that debate between the allocation and the use of boosters in, say, the United States or North America and the provision of vaccines to other places in the world. Certainly followed it as a casual, as a reader of the news, but I can't claim to be an expert or a primary source on it. So I don't know that I have much more to say other than I recognize that there's a tension there, and I've read sharp analyses on both sides of it to understand it better, but I'm not a primary source on it. In terms of what it means for Mainers, the boosters have been recommended by the USCDC. They've been authorized by the UFDA and provided by the US government. They have a strong and direct clinical benefit. We're not going to stand in the way of Mainers getting them.
Got it. And regarding what folks should do when they see sort of state, national, and international recommendations that don't neatly overlap, as we've seen since the early days of the pandemic?
Yeah, there too, Patrick. I think each of those recommendations, going back to the way I framed it, I think each of those assumes a different level of assumption of risk as they go in. The Director General, as you noted, strongly recommended against any type of holiday gatherings. But I think he's looking at a world that is not fully vaccinated, let alone a world where 3 out of every 4 people, as is in Maine, are fully vaccinated. I think he's also looking at a world where boosters are not readily available, all of which drive down the risk. My sense is that when you account for these slight variations in risk and local conditions, the advice is not so much in conflict, it's just not really taking into account these different nuances. So I don't know that there is this stark choice between following the Director General versus the USCDC versus Commissioner Lambert and me. I don't think they're in conflict because our local conditions are in that respect, given how many folks are vaccinated, perhaps more favorable than they would be in other places in the world.
Thank you so much. I appreciate the thoughtful answer.
Yep. Thanks, Patrick. Let me go to Amy Brown next.
Thank you, Dr. Shah and Commissioner Lambrou. Dr. Fauci has said that people shouldn't gather indoors where they do not know the vaccination status of everyone around them. But in Maine, many places, many municipal meetings are taking place in person with no mask requirements and much less any vaccine requirements. And we've heard from listeners who feel that they can't participate in local government without putting their health in jeopardy because of that. They're looking for guidance from the state. I know you probably don't want to get into the whole political aspect of that, but I'm wondering from a public health perspective, what your thoughts are about that.
Commissioner?
Sure. I think it's important to underscore that Maine strongly recommends that people follow the USCDC recommendation that if you're in an indoor public setting in the state of Maine, you should wear a mask. We recognize the fact that, it's been a long pandemic and there's a lot of fatigue that happens, but wearing a mask will help prevent the spread of COVID-19. This is why we strongly underscore that those municipal governments who are holding those meetings follow that advice. We continue to urge any sort of meetings to have some hybrid component to allow people who may be immunocompromised or otherwise feeling at risk of going into those settings, even with masking, has an opportunity to participate. But we continue just to remind people as we're in this winter season where a lot of people are indoors, that if you're in an indoor public setting, please wear a mask.
Do people have any recourse, or who would they get in touch with if they've requested a hybrid meeting so they can participate virtually and that's been turned down?
Yeah, I think they have to refer to their local municipal government on that. I am not familiar with each municipality's policies.
Right, but if the municipality is the one turning it down, is there anyone at the state level that they can go to?
Yeah, I'm afraid I don't know the answer to that question, but we can get back to you.
Okay,
Thanks.
okay. And Dr. Shah, does Omicron spread in ways that are different from other COVID variants, like on surfaces, or does it make it through masks or travel further through the air, or does it just behave differently once it's in someone's body? I'm trying to understand what the mechanisms are that make it more contagious, so much more contagious.
It's a great question, Amy. Here's the bottom line. Based on what we know right now about Omicron, the nature of its contagiousness is a difference of degree, not a difference of kind. I'm glad you raised the questions about surfaces and masks. Omicron does not spread via surfaces. It does not evade the protection offered by masks, because what masks do is block the droplets on which the virus hitches a ride and spreads from person to person across the room, because it's an airborne virus. Omicron does not change that calculus, nor does it change that route of spread. Omicron spreads more easily for biological factors based on how it reproduces in the body and how, as a result of that faster reproduction, it can work its way into the lungs and then hitch a ride on those droplets and spread from person to person. So to the extent folks are concerned about needing to go back to an era where you're wiping down your groceries and cleaning off all of the dollar bills in your wallet, don't need to do that.
Thank you.
Mm-hmm. Thanks, Amy. Let me go to Eric Russell next.
Thank you, Dr. Shah, Commissioner Lambert. Happy holidays to you both. A lot of good questions have been asked, so I'm going to scramble a little bit. The last 3 months, October, November, and December, have been 3 of the highest for deaths from COVID. And I wonder if you've noticed anything trend-wise as to why. Is it just a numbers game? More people are getting contracting the virus, therefore getting hospitalized and therefore dying in some cases? Or is there something else that you're seeing? I mean, the other thing I noticed too is that 3 months ago, we had only 17 people in their 40s had died, and now it's 43. And I'm in my 40s, so that concerns me. Are you seeing anything in the trends that might suggest, why we're seeing more deaths right now, or is it really just the numbers?
Yeah, it's Eric. Just a couple of days ago, late last week, I was meeting with our epidemiology team to go over all the data, and that was a topic of discussion. Or to frame it differently, what can we say from an epidemiology perspective about or what do we understand, I should say, about those who passed away in November, which is the data set that we were looking at. And what you see is a couple things. The first, Eric, is what you spotlighted and I believe to be the strongest driving factor, which is more cases will sadly translate to more hospitalizations, which will sadly translate to a higher number of deaths. So the Delta wave in particular, causing more cases, causing more hospitalizations, causing more deaths. That I would point to as the prime mover in why we are seeing more deaths, simply a byproduct of there being more cases. But the second is some epidemiological factors. It won't surprise you to hear that the top one of them is vaccination rates not being where they should. You're right, the growth in the deaths, which is a sad thing to talk about, but we have to be bracing with our approach to these things. The biggest growth area has been in younger folks, not elderly. There have been a lot of elderly folks who have died. They've often had other pre-existing health conditions that place them at an even higher risk. But the thing that has really stood out to us is the increased numbers of younger people, many of whom are unvaccinated, who are succumbing to the virus. That, of course, leads to greater concern as we think about Omicron. And that's why this question of severity that I flagged earlier is so much on people's minds right now.
Well, and then I think the follow-up question to that might be, how do you create a message that, so you've got this new variant that maybe it's more transmissible than even Delta, which was highly, highly transmissible, as everybody knows, and maybe it's milder. Let's just say that it's milder, even though we don't necessarily know that, but let's just say it. More and more people are going to get this virus. And so obviously that's going to send more people to the hospital and more people will die. So how do you get the message for people who are like, this is a milder disease. Like, what do I care? How do you get the message that, there's a bigger picture here? Or I guess if you had that answer, we'd be out of this by now, right?
Well, yeah, if I had that magic wand, I would have waved it many, many, many moons ago. Eric, two or three observations. First is you're right, and that's why we want to be out there talking about what we know, what we don't know, and how it's evolving. There are a lot of questions around Omicron, but I don't want people to say, well, no one knows what's happening, and so to heck with all of it. We do have a sense, and we're learning more, and we want to equip people with those facts. The second thing, Eric, is that we sometimes presuppose that a lot of the reason for not being vaccinated is misinformation. And that undoubtedly plays a role, but we don't often talk about mistrust as well. We often just use misinformation as the boogeyman. Oh, they've fallen prey to misinformation. But mistrust is a big piece of this as well. One reason that the commissioner and I and the governor and others are committed to talking about where we are and what we know and what we don't know and what's going well and what's not going well is to try to foster some degree of trust so that when we talk about what is effective, people have a sense that, well, these are folks that have been straight with us. So we've been focused a lot on mistrust as much as miscommunication. The final piece, Eric, is, this just underscores why the concept of community matters, why even if something might be a little bit milder for you, recognizing that you are not alone and you don't live on an island, and that even if you yourself might fare okay with a milder case, what about your coworkers? Do you work with someone who's had a bone marrow transplant? What about your grandmother? Is your grandmother as fit as you are? And Eric, if I may say, this is where our colleagues in the media can help us by making sure that all of these facets are covered in a climate where all of these conversations can happen on an equal footing. And I know you do. I'm not suggesting you're not, but that's what's on my mind.
Thank you both.
Yep, thank you. Let me go to Annie from Spectrum News next.
Hi, I think all my questions have been covered, so I'll let us move on. Thanks so much, guys.
Very kind of you, Annie. Thank you. Over to David at the BDN.
Thanks, Dr. Shah. We're seeing a lot of changes due to Omicron and rapidly rising cases and hospitalizations. Is the Maine CDC considering going back to daily case counts and media briefings because of this environment?
We do daily case counts, David. Those are updated on our website every morning, as well as daily hospitalization numbers, hospital capacity, vaccinations. We're not changing that. That hasn't changed. We're evaluating it along with other states and the CDC because we also want to make sure that our operational tempo reflects data that are, that people need. But the rapidly rising cases are, of course, what got us here and resulted in Delta and Omicron. We don't have any intention right now of dialing back on that daily case reporting. We're looking at it because I know the USCDC is looking at moving to a different operational tempo. But for right now, given what we're staring down, we're not pulling back on that.
I guess my question was about, cases on weekends, because they're not reported on Saturday, Sunday, and Monday, correct?
That's correct. You're right. We don't do case investigations on the weekends. And for that, we don't have any intention of changing. The other piece that's really important, David, is that although it's important to know what these case counts are, the ones that we think, so first of all, they are reported on Saturday, but they're not reported on Sunday. And the other evolving notion amongst many epidemiologists is that the data that are really the most useful and instructive for where we are in the pandemic are data around things like hospitalization rates, ICU occupancy rates, things of that sort, less so the daily changes in case count, which can fluctuate based on so many other variables.
Great, thanks for answering that. You mentioned Satrovamab earlier about the only monoclonal antibody that can be used to treat Omicron. Does Maine have enough of these treatments to treat numerous new Omicron patients who get this variant? And how does access in Maine compare to the rest of the United States?
So the allocation of monoclonal antibodies it follows a formula that's set by the US government, and jurisdictions are allocated a set amount, again, based on population, disease rates, things of that sort. So Maine gets what is allocated to us by this formula. I wish we had further or more supplies. I would take everything we can, and we've made requests for additional supplies, given the increase in cases here. But this is not a drug that's available for purchase on the open market or anything of that sort. It's allocated to us by the federal government.
And does Maine currently have enough to treat, a score of new Omicron patients?
No state does. No, the United States as a country does not. Because up until very recently, the other two monoclonal antibodies, Regencov and a combo called BAM-EDI, were the two that were preferentially used with Delta. But now with the shift to Omicron, Satrovamab, which was previously not used as much, will be the one. And we understand that GSK, the manufacturer, is ramping up their production as quickly as they can. But these drugs are difficult to make. They are highly sensitive, must be created under very strict laboratory conditions because they are effectively synthetic antibodies. That will take time. I wish as a country we had more Satrovamab because if the country did, then Maine would.
Great, thanks. Just final question. Do you have any kind of gauge on what percentage of cases right now in Maine are Omicron?
It's about 3% or so, at least based on what we've detected. But that number is almost certainly higher today than it was on Friday, and which is when we reported it out, and it will almost certainly continue to grow. So that is an estimate based on what we sample, and it is, as with all testing, it's a look back, not a look forward.
And there's a widespread expectation that it's going to be the majority. You said within a few weeks, probably likely.
It's probable. I can't make a promise or anything of that sort. That's just what various mathematical models predict, as well as based on the experience in Denmark, the UK, and in South Africa.
Thanks so much, Dr. Shah.
Yep, thanks. And the last question goes to Brian.
Good afternoon, Dr. Shah. I'm going to be really quick. An article was released over the past weekend stating that if Aroostook County were a country, it would have the third highest rate on the planet. What are your thoughts on that statement, and what can Aroostook County do to immediately slow the spread? And do you believe that we're at a level of seriousness where mask and social distancing mandates may be necessary?
Sure, Brian. We're certainly aware of that. Yes, it's concerning. But what can folks do? The key things right now are not different from what they have been elsewhere or previously in the pandemic. Getting vaccinated, getting boosted, wearing a mask anytime you're in an indoor public setting, as well as maintaining distance and improving ventilation in spaces where you are. All of those things taken in concert can absolutely help right now. It's also important to note that there are some interesting data elements that happen with that. When you have a small county with a small population and a significant increase in a short period of time, it's easy for a county to rocket to the top and then fall off. So there is a bit of what we've called the carousel effect, but that doesn't diminish the seriousness. Folks in the county, as well as folks in the other counties that were noted in that report, this is an opportunity to take action.
Thank you, Dr. Shah.
Yep, thank you. Commissioner, I'm going to turn things over to you to close us out for the afternoon.
Thank you. While the holiday season can be a time of joy, it's also normal to feel mixed emotions and increased anxiety, especially with this seemingly never-ending pandemic. If you or someone you know needs help, a variety of resources are available. Strengthen Me is an initiative to help Maine people cope with the stress and uncertainty of the COVID-19 pandemic. You can call Strengthen Me at 207-221-8198 or visit strengthenme.com. We also operate a Frontline Warn Line, which is a dedicated phone service for healthcare workers, first responders, school staff. You can call that number at 207-221-8196, 7 days a week from 8 a.m. to 8 p.m. And for people who are feeling overwhelmed by depression or anxiety, crisis support is available 24/7. You can call the statewide crisis line at 888-568-1112 or text us. Tending to your mental health is as important as protecting the public health. We encourage you to be mindful of both during this holiday season. And meanwhile, we wish each and every one of you happy and healthy holidays. Thank you.
Thank you, Commissioner. On that note, I hope everyone has a good afternoon. We look forward to chatting again soon. As always, be kind and take care of one another. See you all later.